So coming to the congenital heart disease, before starting any segment, we always have a quote, and the quote for today is, don't lose focus. No matter what happens in life, sometimes we are losing focus. So don't lose focus in life. Everything happens for a reason. Try whenever you study, try to make a concept while studying. It will be easy for you to learn. What are the causes of radiofemoral delay? There are some conditions where the patient radial artery and the femoral artery will not be coinciding together. Normally, what happens? My radial and femoral artery should be coinciding together. If it's not coinciding, I can land up into a problem known as radiofemoral delay. And one of the important conditions must appreciate is coarctation of aorta. In a case of coarctation of aorta, there is radiofemoral delay. Number one. Number two, very importantly, one thing you should know for starting off with the congenital heart disease and everything, you a simple basic question if they ask in exam, what is the normal blood pressure of a 4-year-old child? What is the normal blood pressure of a 4-year-old child? Remember, we have a formula for systolic. To calculate the estimated systolic blood pressure, the formula is 90 plus age into 2. For calculating the diastolic, the formula is 55 plus age into 2. So 90 plus age into 2 for systole and 55 plus age into 2 for diastole is the formula to calculate the blood pressure in a 4-year-old child. So this is a simple one you should know. Okay, 90 plus age into 2 and 55 plus age into 2. And if you do that, so let's see what is the answer. The answer for this one will be 98 by 63. So 98 by 63 is the formula. So these are conditions are like for to in a congenital heart disease, you need to check the blood pressure because there are some congenital heart disease where the blood pressure of the upper and lower limbs are different. That's why this question has come in cardiology in congenital heart disease, that what is the normal blood pressure of a 4-year-old. Let's go to the next slide. Yes. So calculate the heart rate of the patient. This also very nice question. How do you calculate the heart rate of a patient in ECG? A lot of time in cardiology chapter, they ask us to calculate the heart rate in ECG. To calculate the heart rate of a patient through ECG, the formula for that we have is 1500 upon number of small squares between the RR interval. 1500 upon number of small square between the RR interval. So this is very important. Remember, this is the R, and again the upper one. These all are the R's. This is also an R. This is also an R. These all are RR interval. So 1500 upon number of small squares between the RR interval is the formula for the calculating the heart rate. So if you calculate this, one large square consists of 5 small squares. So this also large square consists of small 5 squares. So one large square will have a small 5 square. And to calculate the heart rate, it is 1500 upon number of small squares between the RR interval. And for that, the answer comes around 75 beats per minute. Which criteria do you use to diagnose the presence of congenital heart disease? The criteria we use to diagnose congenital heart disease is known as something known as NADA's criteria. In the congenital heart disease, the criteria to diagnose, like for example, if you are the doctor on duty, you have a patient admitted with you, and you give me a call saying that, sir, I have admitted one patient. I think this patient has a congenital heart disease. So the criteria we usually follow for that is known as NADA's criteria. NADA's criteria is divided into major and minor criteria. If the patient has come to you, number one, you will auscultate the patient, and while auscultation, you will see the murmur. If the patient has a systolic murmur grade 3 or more, or if the patient has any diastolic murmur, these are the important points for the NADA's criteria. Number one, systolic murmur grade 3 or more. Number two, any diastolic murmur. Then remember C or C. If the patient is having little cyanosis, or the patient is having feature of congestive heart failure. So C for cyanosis, C for congestive heart failure, Systolic murmur grade 3 or more, or any diastolic murmur is the major criteria for NADAs. Now, what is the minor criteria? If naturally systolic murmur grade 3 or more is major, then any diastolic murmur, like as in any systolic murmur grade less than grade 3, or four abnormalities. The four abnormalities must appreciate over here. If the patient has a abnormal blood pressure, abnormal ECG, abnormal second heart sound, or abnormal, so chest X-ray, blood pressure, ECG, and what else? Chest X-ray, blood pressure, ECG, and abnormal second heart sound. So these are the important points regarding the minor criteria for the NADA's criteria. So I'll repeat again, in this class, I've got an idea that to diagnose a congenital heart disease, we have the major criteria and the minor criteria. In the major criteria, yes, systolic murmur grade 3 or more. You can say any diastolic murmur, any cyanosis, or any features of congestive heart failure. What is the minor criteria? Systolic murmur grade less than 3. Anything abnormal, as in abnormal second heart sound, abnormal ECG, abnormal chest X-ray, or abnormal blood pressure. One question they ask in exams, that how many major and how many minor criteria do we have in a case of NADA's criteria? So remember, we have one major and two minor. One major plus two minor criteria, if it is there, then I will say I think this patient has a congenital heart disease. So that's also important point, must appreciate for exams. Then also, I just now told you that systolic murmur grade 3 and any diastolic murmur. If I say systolic murmur grade 3, now how many grades of murmur do we know? That's an interesting question. There are total 6 grades of murmur. How many grades of murmur are there? There are 6 grades of murmur. Yeah. So there are 6 grades of murmur, number one. Number two, in which murmur they ask in exam? Yeah. Which murmur is moderately loud with a palpebral thrill? Interesting question. Which murmur is moderately loud with a palpebral thrill? So murmur which is moderately loud, let's see. Yes, that is grade 4. The murmur which is moderately loud with a palpebral thrill is a systolic murmur grade 4. Now you need to know how many grades of murmur are there. I told you which one was this grade. This was grade 4, moderately loud with a palpebral thrill. This was grade 4. So if I say what are the various grades of murmur, so in number 1 we have the grade 1, which is a very faint murmur. We have a grade murmur 2, which is a soft murmur. Moderately loud with no thrill is grade 3. Moderately loud with thrill is grade 4. So 3 and 4, these are the exam questions. Grade 3, grade 4, grade 3, grade 4. So moderately loud, no thrill. If the murmur is loud with no thrill, that is grade 3. And if there's a thrill, that will be grade 4. Okay. Yeah. So yeah, exactly. So and grade 5 will be very loud murmur, very loud murmur with thrill, which can be heard with the stethoscope partially off the chest. So grade, oh, yes, exactly. So grade 5 murmur will be very loud with thrill, and grade 6 murmur is the loudest. Grade 6 murmur is the loudest. So very faint, grade 1, soft, grade 2, loud but no thrill, grade 3, loud and with thrill, grade 4, very loud with thrill, and that will be grade 5. And grade, what is grade 6? It is the loudest with everything. It is the loudest with thrill, and you can hear the murmur with stethoscope entirely off the chest.